Swayam Prabha. Digital India. Educated India.
Dear students and participants, so in this lecture we'll discuss about the ethical issues related to biofabrication. So first we'll start with what is the ethics and what are the different ethical issues for this bioprinting or organ printing, and we'll discuss different regulatory challenges that needs to be taken care of before we actually use this 3D bioprinting technique for organ printing and also for development of different tissues and organs. First, let us start with the ethics. What is ethics? If you see, ethics deals with the systematizing, defending and recommending concepts of right and wrong conduct. That means ethics actually help us to understand what is right and what is wrong, and that's why ethics is very important in all day-to-day activities of our life, and also in case for organ printing. And the term ethics derived from the ancient Greek word ethikos, and which is actually again derived from the word ethos, and ethos means habit, customs. So that means this, what is the custom in certain case. If we follow the custom, then probably that can help us to lead our life in a better way. So that's why ethics investigate the questions: what is the best way for people to live, and also what actions are right or wrong in particular circumstances. Like, so for organ printing also ethics is very important, because if we follow certain practice in a particular way, then will not that can help us to use this technology for betterment of human or betterment of people. Like but if this technology, like all other technologies, this technology can also be misused, and then there can be several adverse effect or several challenges can be brought out. So ethics, understanding the ethical issues for this technology is very important, and probably this can be, because now till now we have discussed about various different types of 3D bioprinting techniques there, and the features, different components of this different 3D bioprinters, and also different applications of 3D bioprinting technology. Now, with this lecture, I would like to highlight that with with the technological progress, there can be new challenges, and we need to tackle this with with proper consent and also proper understanding of these issues, right? So that's why ethical issues is very important, and this is the last lecture of this course, and this is a very important topic to discuss. So let us first understand what are the different issues for ethical issues for biofabrication or organ printing. You see, there are different issues, but I have here uh, clubbed them into three topics, three sections, like justice in access to healthcare, testing for safety and efficacy, and enhancement of capacity of individuals. You can actually discuss this point, like here. This reference actually here you can find most of the information. So please go through this. This can be your reference material for understanding this topic. So cost of the first is like justice and access. So if you see, with all technologies, the most important thing is to reduce the cost of, while we advance the treatment. Suppose the treatment option can be advanced further, but it should not be so high that it is out of reach of for most of the people. Means the cost of treatments for any new technological intervention, that is very important, because with 3D printing there is a understanding that the cost of the treatment can be very high, because here we are talking about personalized treatment. So here we concerned about the treatment for a particular person to treat. Suppose somebody has a problem in their, somebody has a liver failure or kidney failure, so we need to replace that. So with personalized treatment there can be the increment of the associated cost, and if the cost increase, then also it can increase the disparities in health between rich and poor. So whether maybe the rich people can afford this technology, but what will happen to the poor people, whether can they access this technology, whether they have, suppose they can have the money or fund to support the treatment or to pay for their bills, all these things. So disparities in health between rich and poor can be widened with with the new technology, personalized technology like bioprinting. But it is our job to see, or to develop cost effective bioprinting technologies, so that the it should be accessible to everyone. Either it can be irrespective of their, whether they are rich or poor. So that is the major ethical issues, that the cost of the treatment should not be very high, and that we have to look for this all the this the biofabrication community as a whole. We need to work for that, so that the technology can be affordable for everyone. The next thing, the genomics and stem cells. So if you see, or if you just, you can also search for this, like the ethical issues related to stem cells or even genomics. There are a number of ethical issues. I'm not going to details of this thing, but let us discuss a few points there. With stem cells there are many ethical issues or even controversies, like the source of the stem cells. Mostly the source, if you it is pluripotent stem cells, then the source is the fetus or the that thing. So from where there, or the embryo, from there we can collect embryonic stem cells. And the embryonic, because the embryonic stem cells are very powerful, they can produce most of the cell types in our body. So that's why they are very powerful and we can use that. But there it is a ethical and moral issues, whether a fetus can be used or embryo can be used to isolate that stem cells. So there are many concerns on this thing, and this thing issues are actually, there is no proper guidelines as of now. It is banned to use embryonic stem cells from fetus or embryo for any kind of cell therapy treatment. So there it lies a huge ethical issues or challenges for use of that stem cells. Now the next thing is stem cells, like this pluripotent stem cells can also be developed by iPSCs. Now iPSC is one such technology where it is out of this ethical or moral concerns, because it is the patient's own cells are mostly used, the primary cells are mostly used to develop this iPSCs, because we can collect, suppose we can collect the fibroblast from the skin of the particular person, and then that fibroblast can be reprogrammed to generate iPSCs, and from there it can again differentiate to different cell types like bone, muscle, even different cell types. So one way the source is not that controversial, or it is mostly is easy and accessible. But there is another concern, whether we have the right differentiation technique to develop a particular tissue lineage. Like suppose if we have iPSCs, now can we guarantee that we can only differentiate that iPSC towards, suppose our interest is to develop that bone into osteoblast? or whether that in that process, if we don't have control, that can lead to tumorigenicity also, development of tumors, because the stem cells are very powerful, very potential or very powerful. They can also lead to tumor development. So that's why we have to work on development of that certain process and technologies by which we can control their differentiation, and a particular technology thing is can be possible, right? So these, there are again, there are other stem cells. Now till now, if you see, most of the cases again in India, we cannot manipulate the stem cells. We can, what we can, suppose for autologous stem cell transfer, what we can do, we can collect the patient stem cells and we can use it directly without any in vitro expansion or manipulation of the stem cells. We can collect this and put that into the patient. So that kind of things is allowed, but any experimentation or any in vitro manipulation of the stem cells are not allowed in India. But for bioprinting, mostly we need to do that. We need to expand stem cells. We need to culture them, and we need to put them in the bioink, and then we can print a organ. So there, they again, this is one another ethical or regulatory challenges when it is not allowed. But again, so how? So there are some regulatory bodies or people have been working on this, how this thing can be tackled. So these are various issues related to stem cells and genomics. Then the, in case, because it is a personalized medicine, right? The organ printing is mostly comes under the, mostly it is under the personalized medicine. So like all other personalized medicine, this can offer best treatment based upon the conditions. Like suppose, if somebody, like suppose a boy or a girl, when they are growing, so maybe a personalized medicine can best offer a best solution for their treatment, because along with the growing, along the, when the boy or girl growing, if we developed or print an organ or put into that person's body, or that boy or girl's body, then that organ should also grow with the person. So that's why this personalized treatment can, medicine can best offer best possible solution when based upon the condition, maybe. And also, like, because it is personalized medicine, so it has to be tailored towards certain people, like towards a particular need, particular person. So there also challenges. Now how can we check that whether this personal medicine can be effective for that purpose or not? So here also the another thing can come, whether this is accessible for, please recall my first point, whether this personal medicine can be accessed by most of the population or not. With 3D bioprinting or organ printing, another thing, another possibility is it can also reduce the time and cost of customization, because the cost of production and customization cost can be minimized with organ printing. But now there is a notion that the cost of treatment and that this thing and for customization can be very high. So it is our job again to look into that, so that the technology, this, we have to develop, come up with a cost effective technology, so the cost of production can be not be, can be very high, and also the customization cost can be lowered, right? So these are another, this is another issue or another concern in case of justice and access, whether cost can be the time. Another thing is, suppose somebody is waiting for an end-stage organ for an organ, they are under some support, so they need transplants immediately. So how can we produce this, or produce this kind of organs or tissue in a shorter time? That can be another issue, another ethical issue, because if suppose if it is takes longer and if it cannot serve the purpose, then what is the, what is the use of that kind of technology? So that's why reducing time and cost of customization is another thing. Other thing is accessibility. As we have already discussed in the, in case of cost of treatment, we need to come up with affordable implants and prostheses so that it can serve the purpose of many people, and it should be accessible by many people. So these are the some of the ethical issues related to justice and access. Now, whether the next point is whether this kind of treatment is safe and effective before it is offered for as a clinical treatment. Now, how can you check the safety of this thing? If you see, most of the time, different drugs or medical products are tested, the safety based upon doing some clinical trial, right? For this clinical trial can be for, depending upon the application use of the device, this clinical trial can be for shorter duration and longer duration, right? Now the safety has to be checked for this kind of bioprinted organ for long period, and also is there a new risk from the material. So that thing we have to understand, but mostly, so I'll discuss these 2 points together in the thing. Now the efficacy. Now, development of printed functioning organs that can replace patients' damaged organs. So, though it should be effective, because the purpose of organ printing is to come up with artificial organs that can save patients, that can perform the job of the diseased or damaged organ, so that it can replace that organ, and it can perform the functions of the body so that the patients can be healthy. So now, how do we check safety and efficacy of these things? If you see, for all these different drugs and medical products, that safety and efficacy are mostly evaluated by double-blinded randomized clinical trial, RCT, randomized clinical trials. You must have heard this before. So, but this kind of personalized medicine, how do we do that randomized personalized trial? Randomized control trial is mostly done when, suppose we randomize the patients, and then some treatments are given to different treatments are given to these people, and then we evaluate whether the, suppose a new treatment, whether it is better than the existing one or not. But when we actually do a organ printing, then we develop tissues or organs for that particular patient, so it cannot be randomized. So it is because it's a tailored product, so the control, the safety and efficacy evaluation should also be tailored. So we need to come up with guidelines, we need to come up with evaluation techniques by which we can actually check the safety and efficacy for that particular bioprinted or tissues and organs in a way, in certain ways, so that we can, so that this cannot, because this cannot be done by the other way, like this randomized clinical trials. So we need to come up with new models for testing their treatments and safety and effectiveness. So that is very important, to come up with new treatment, new modalities, new procedures, or new models, or new systems to check the safety and efficacy of this treatment for the patients. That's why these different regulatory bodies also, this have to give approval for new treatments, such as US FDA, DCGI will also need to establish new standards of testing for regulatory approval before these treatments can become readily available. So now it is not only technological limitations, it is a regulatory challenges for different regulatory bodies to come up with new standards and new testing procedures, so that they can evaluate this kind of bioprinted products like this, or like this customized products like bioprinted organs, even tissues, and so that then they can be given approval for treatment, for further use of this technology for human population. So that's why, if you see, there are, till now there are no clinically regulatory approved clinical products or bioprinted products available, because the thing is that till now we have most of the time, most of the regulatory bodies, they don't have any standards, and they have to come up with new standards for checking the safety and efficacy of these things. So that's why it is not only technological limitations for, as we have discussed earlier, till now no clinically approved, no bioprinted products approved for clinical applications. So because it is, the challenges of twofold, like the first challenge is of technological challenges, and the next is the regulatory challenges. Though we need to develop this technology, we need to further enhance the technology to so that this can be used for this can be so that we can actually bring up the different artificial tissues and organs. But there are also regulatory challenges because the regulatory body also has to come up with new standards and testing procedures for so that they can evaluate the safety and efficacy so that then the bioprinted products can be used for transplantation. So these are the points related to safety and efficacy of the bioprinted products or organ printing products. The next thing is it is very this thing this situation is very tricky. Like let's suppose with all technology, there comes there can be misuse of that technology. So the control of that technology from misusing is very another important issue. So that whether this technology should be used for human enhancement or not, because we have discussed this, like we have now probably understand that this technology can be used or organ printing can be used to develop new tissues and organs. So there also the this technology can be also used to develop human capacities beyond what is normal for human beings. Suppose so this technology can be very well used to develop or enhance the human capacity. Then the what is known as the limit be or normal human being, like replacing our existing bones with artificial ones that are stronger and more flexible and less likely to break. So this can be suppose if someone can come up with this kind of technology or or a method where they can print bone tissue constructs, those are stronger and more flexible. So they will be less likely to break. Then the also another thing is suppose improving the muscle tissue so that it is more resilient and less likely to become fatigued. Implanting new lungs that oxygen more blood more efficiently even in more polluted environment, right? So these things are some of the examples by which human capacity enhancement and also the that means enhancements of that human capacity can be developed. So these things enhancement of strength or duration beyond what is natural, whether that is allowed or not, right? So something can be like this kind of things can bring new technological new challenges in the society, because this thing can be because some people can work for this kind of development of this kind of technology where this can help in enhancement of or enhancement of the capacity of that person. So there can be another issue like if suppose bioprinted organs are suppose we have reached that day where bioprinted organs are more not normal, right? So then whether this bioprinted organ then the bioprinted organs can be can be a routine use for different treatment different instance like suppose people suffer from different instance like disease, so there this kind of bioprinted organs can save them. So there can be, and if these are not controlled properly, then there can be illegal trafficking of bioprinted organ. Like till now you must have heard or you must be hearing about different so illegal trafficking of human organs, tissue and organs. Like there is a there are rackets who work on trafficking of human organs. Like because they collect the human organs from a particular people, and then that is sold in the black market at very high price because there are huge number of patients awaiting for transplants. So then and they are ready to pay whatever the amount they ask. So that's why this illegal trafficking is a huge is a is wrong, but there are people who actually involved in this kind of thing. So that's what with bioprinted organs the same fate can be there. The bioprinted organ can also be used for illegal trafficking. So we need to control that illegal trafficking and how it can be done, how this thing can be like this. So their administration, government, police, everybody should come together and we still need to frame law for to prevent this kind of misuse of this bioprinted organ. The next limitation limitation is the military use of this technology. Suppose if this 3D printing technique or this organ printing technique can be used for development enhancement of human tissue, human enhancement of human capacity, then it can be very well used for military. Every nation, they want their military to be stronger, resilient, and less and suppose and less adverse effect can happen, or less challenges can for their military. Like this, suppose everybody wants a everybody wants, or all nation wants that their military to be stronger. So suppose if they can produce a human being where they are less likely to be fatigued and they can work in a very extreme conditions also, and they are less likely to get injured, then that can help, that can help to that military to use their power for certain cases. Like like we see now there is a armed race. So everybody is trying to develop new amino acid, new type of nuclear capabilities. All these things that people are working on. So there can be arm race for bioprinted organs in the future. Suppose this technology is this technology is effective to develop artificial tissues and organs. So there can be a arm race where different nations, they can work on developing this kind of bioprinted organs, and that can be used for their military. So this kind of military use of this technology should be minimized, and so it has to be addressed in a proper way. So the good, but the thing is that with all technology there comes responsibility, because whether we should use the technology for betterment of human people or betterment of human, or we can misuse that. This is our job to address these issues. So that's why there can be some different ethical and social issues can emerge as the technology progresses. We need to be get ready about this thing. So this kind of things we need to tackle with our conscience and our concerns. Like, so there can be very various uh, issues can emerge, but we need to tackle those things. But and also promise of better treatment while changing communities to address emerging ethical questions. Though there are many ethical issues, but we need to work for that while taking everybody together. That this technology has huge prospect, and we need to address those ethical issues as I mentioned for stem cells and other technologies, other things, so that we can come up with better technology that can help communities and that can help human population. So that's why we need to take this thing. Like suppose when you are working with medical data, or medical or human tissues, and also for human volunteer or subjects, then we need to work with them. Like we need to collect informed consents for donation. Material manipulations has to be tackled in a certain way. Storage of that thing is further use, including for commercial and research purpose. So all things has to be taken care of. Like we need to collect informed consents from the people who are actually ready to donate, and also then how this material can be manipulated, and this can be storage, like this human tissues and organ, how this can be storage, and for its further use, and for commercial and research purpose. For both these purposes, this has to be taken a thing. Now suppose when somebody donated their stem cells, then it is whether that is whether that belongs to him, and whether he can have right over that the use of that stem cells for further applications. So that thing has to be addressed, and that has to be done. Now the development of requirements for safety, quality, and efficiency of technological procedures and the end products obtained by 3D printing, taking into account the human rights and dignity. So that is also another challenge that is also we have to do. So we have to come up with certain process by which we can check the safety, quality, and efficiency of the technical procedures, so that this can help many people. So this has to be again used with caution, and again the different regulatory body also, they have to come up with committees for creation of regular and regulation of national guidelines on technical, legal, ethical issues related to development and application of 3D bioprinting technology. As we have mentioned in the as I mentioned in the earlier slide, that that different till now it is not that common, or there is a lacuna in this case in here where there's regulatory challenge or it's a regulatory challenge, but different funding agencies, they have to come up with national guidelines on these technological, legal, and ethical issues related to biofabrication or related to organ printing. How this thing can be tackled. If suppose there is a issue, there is an ethical issue, then how this thing can be tackled. So this funding bodies, or this sorry, the regulatory bodies, they should, like in our case it is DCGI, they should come up with certain regulation so that it can be tackled. Then also the establishment of regulations for turnover and limits of course commercialization of 3D bioprint technology for human organs and tissue. Now, suppose this technology is capable of producing human tissue organ, then what is the turnover? Like some industry or some maybe medical or maybe the hospitals or medical or clinics, how much they can actually produce this kind of things and how much they can commercialize this thing, that also has to be a control to do that, to actually to so that there should not be misuse of this technology for this thing, misuse of this technology for further applications. Now there are other issues like when, like suppose when the bioprinted organs are used for clinical applications. So now it is the job and responsibility of that producer, so suppose the bioprinting industry or the medical people like this hospital or clinics. So who will take responsibility for this kind of for this thing, and who will be accounted for this? Suppose if there is any mishap or something, who will be accounted for this? So these things also we need to use. That's why this technology has to be used with caution. Now the other thing is, suppose the volunteers when they actually go for clinical trials like this kind of for bioprinting thing, when some there is a volunteer who actually helps in evaluating this or who actually signed for clinical trial. Now for volunteers or anybody, there is a right that they can withdraw themselves from the trial in any state of the in any time point of this trial. But for biofabricated organs or tissues or organs, bioprinted tissues and organs, it is very difficult. Once it is implanted, how that person can be opt out from this clinical trial, right? So these are issues to be discussed, and these are issues to be and new solutions should come out of from these issues, right? And also another thing is also, like suppose somebody is actually undergoing a clinical trial, and suppose he want to opt out, he should be given another treatment option. Suppose in case of any adverse effect. But in case of bioprinted organ, again there is a challenge is what kind of treatments it can be given, alternate treatment can be given. So those things has to be addressed. So that's why there are many ethical issues and challenges. And please read that. Sorry, please read this paper, literature, and there are many other literatures available on this bioprinted, the ethical is regulatory challenges for bioprinted tissues and organs. So, and there are many ethical issues and challenges. Please go through the literature. There are a number of literature available on this technology, and please understand these are very important issues to be tackled. When this technology develop with it, there is a technological progress, and we reach one day where we can actually generate artificial tissue organ that can save many patients. But with this, as I mentioned earlier, with this thing, responsibility should be there by using this technology. It should not be misused. Thank you very much for attending this lecture, and also I would like to thank all of you for attending this course. With this lecture, actually this comes to this is the end of this course, and I wish you all the luck, all the best for in your 3D bioprinting or endeavor, or for also for your research work, further research work in this 3D bioprinting and organ printing. You can, this technology, as I mentioned earlier, and I have been saying this technology has got huge prospect, but we have to use this technology with caution so that this can save many people, and we can improve this technology further so that we can one day, there are nobody should wait for artificial, nobody should wait for donated tissues and organs, and this technology can has the capability to provide artificial tissues and organs. Thank you very much again for attending this course. I wish you all the best for your future endeavor. Thank you very much.